Welcome to MRO's Tuesday Talks, Population Health Edition. In every talk, we'll explore the latest trends and strategies in value-based care, addressing the challenges healthcare organizations face in enhancing operational efficiency, reducing administrative burdens, and achieving shared goals.
Population health management rests on 5 core pillars: risk stratification, care management and coordination, gap identification and closure, patient engagement, and outcomes measurement, all powered by advanced analytics. Let's start with risk stratification, the foundation. It involves analyzing clinical claims and social determinants of health and categorize patients by risk level, predicting who is the most likely need to get into a complex healthcare setup. A study published on Archive found that predictive models using massive health datasets achieved an accuracy of over 91%. Can you believe that? When identifying very high-cost patients. So earlier identification like this, are enablers for more proactive interventions well before costly hospitalizations or major events occur. The second pillar is care management and coordination. Without it, patient care becomes fragmented. In fact, according to New England Journal of Medicine, the average Medicare patient sees 7 different physicians across 4 separate practices each year. Care coordination tools give all providers, from primary care to specialists to case managers, a shared view of the patient's history, avoiding duplication, medication conflicts, and missed follow-ups. Gap identification and closure is what I call the third pillar. Despite all the medical advances today, a big chunk of American adults miss at least one or more recommended preventive services annually. Real-time EHR alerts can prompt clinicians when a patient is overdue for a mammogram, a colorectal cancer screening, or chronic disease monitoring, allowing teams to act immediately during the encounter rather than react months later. The fourth pillar is what we call the patient engagement. This is the first pillar where we bring in the patient in picture. So it's not enough to coordinate care, patients must also actively participate. That's the fundamental here. Research consistently shows that engaged patients are most likely to adhere to treatment plans and achieve better health outcomes, with better patient engagement. And technologies like patient portals, telehealth, remote monitoring have been shown to significantly boost engagement, especially among patients managing chronic diseases or living in remote areas. And finally, but I would say the most important pillar is outcomes. The outcomes measurement, true population health isn't just about providing more care, it's about providing better care. And according to American Journal of Managed Care programs that enabled continuous measurement and feedback loops, have achieved close to about 20% or more than that improvement in chronic disease control rates within just a few years. And tracking metrics like hospitalizations, emergency visits, and disease-specific controls allows all of the health system and practices to course correct quickly and sustain improvements. And at the heart of all of this is analytics, not just collecting data, but transforming it into insights. According to the World Economic Forum, healthcare generated just in the US, healthcare generated about 2.3 zettabytes of data in 2020. And this is talking about 5 years ago. And the numbers must have gone exponentially higher with more digitization efforts. And yet much of it remains underutilized. So again, analytics powers everything. And in summary, population health management isn't just a set of isolated tasks. It's basically, I would call, a connected strategy of prediction, prevention, engagement, coordination, and improvement, creating better health outcomes across the system.